Greetings, friends and followers. This is Nurses Talking. I am Del Barzi. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. And today I am very, very pleased to welcome Constance Johnson, or she'd like to be known as Connie.
Yes, thank you.
Uh, Connie is a registered nurse with over 30 years experience, and her career began as a nurse's aide on an orthopedic unit. In 1989, she received a BS in nursing and an MS in 2006. Along the way, she gained experience in med-surg, oncology, and the nursery before making the CCU her permanent home. She's worked as a home health aide, a diabetes educator, and school nurse, and she's also served as adjunct faculty for a local community college. Connie functioned as a nurse's aide, coordinator, and instructor for 15 years prior to embarking on a new career in remote nursing. So, welcome, Connie.
Thank you so much. Thank you, Dale, for having me.
It is my great pleasure. So, the first thing I want to know is why you're a nurse. What brought you to this?
Yeah, so it's two reasons, but this is the main reason. When I was in high school, I had a favorite aunt that was ill and she passed away. And so we had no medical, no nursing folks or background in our family. And so what we understood was that the doctor was treating her for the wrong condition and she passed away. And so that's what, families, that's what we understood. And so I was going to make it my point that no one else in my family would be misdiagnosed again. So I decided to become a nurse. When I went to nursing school, I found out that what the doctor was treating her for and what she passed away was connected. So, my family didn't know, we didn't know because we didn't have that nursing or medical background. So I guess you can say I became a nurse by misinformation, but I wouldn't change it. I wouldn't change it.
Oh, that's awesome. That is awesome. And this is the first time that is couched that way. You became a nurse by misinformation.
Misinformation.
That is so cool. Not cool that you lost your aunt, but
Yes, yeah, yeah.
somehow in a roundabout way it brought you to this. But what were the challenges for you then?
Mm. My challenge started in nursing school. Nursing school, I found nursing school to be very, very challenging. I found reading those massive books challenging. I had poor study habits, and I barely made it through. You know how nursing students find their niche when they go to different clinical settings? I didn't have that. I didn't like it, period. But I was determined that I was going to finish. I almost quit several times, but thank goodness I had a supportive family. And that's how I made it through. That was my first challenge. But that second challenge was that NCLEX. And that's a whole nother story. So
Yeah, that's a beast.
yeah,
That is a beast. So you worked in several different areas.
I did.
What made you settle on CCU?
I did a home because I started out as a float nurse and I floated to all these units, which I love because it helped build my confidence as a new nurse, helped build my skill set. But I wanted a home and I went to CCU, stayed at CCU about a year and a half. I had a little one at home. And so I would get off 7 o'clock in the morning and he would be this bouncy little boy, full of energy. And I realized that those 12-hour shifts were not what I wanted to do. I burnt out really fast. I was only a hospital nurse for probably about 5 years before I ventured out and tried something different. So
Mhm.
yeah. But I did home health. Home health was my passion, my love. I did it for 12 years. And that was one of the reasons why I went back to nursing school because, I had so many patients with all these illnesses. I just wanted to learn more because I wanted to be able to teach them. And that's why I went to get my master's in nursing. I took the nurse practitioner route because at the time, it was nurse practitioner or a clinical specialist. I'm like, maybe I'll do the family nurse practitioner. Now, halfway through that, Dale, I'll tell you, that was rough as well. But because it was a couple of the clinical experiences that I had, I was like, this is not what I want to do. This is really not what I want to do. But I'm not going to quit. So I completed it. I got my master's in nursing, and that master's in nursing helped me with getting a job at college as an adjunct faculty, and it's also helped me in other areas. So yeah,
Yeah.
and then I went to the school system, school nurse 4 years. I like that as well. Then I transitioned into the classroom. That's what I did for 15 years. I was a program coordinator and instructor for a nurse aid program at high school, which I loved as well because I love teaching. Um,
Mhm.
then I decided there was my season was over with that. And I
Yeah.
wanted to venture out and do something different. And I had always heard about remote nursing. As a nurse, we feel like we need to be at the bedside. So my first thought was, what on earth can a nurse do from home? And I started to research and research and research, but there's a lot that nurses can do from home. So I made myself remote ready. I took courses, I'm part of this Facebook group for remote nurses, and then I stepped out on faith and I put in some applications and I was offered a job. So I am a telephonic nurse care manager right now from home. Been doing this for 6 months now.
Absolutely fantastic. Absolutely
Uh,
fantastic. So I'm going to ask you to expand a little bit on that, just
Mhm,
because
mhm,
one of
mhm.
the goals of this is that I really want nurses to see what nurses are doing and how they can do the same.
Right,
So
right,
yeah,
right.
you took some courses and all that, but getting into remote nursing, what I'm going to go back to challenges
Mhm,
again, because this is so
mhm.
different from having a support system right there, another body at your bedside. How does that work for you? How does that challenge you?
You mean as far as being a remote
Yeah.
nurse?
Yeah.
Um, I am just honing in on my home health days because as a home health nurse, you are out there all by yourself and you have to rely on your assessment skills and your gut feeling, and that critical thinking. So transitioning to home was not hard for me. And I have a great team, they're just a message away. And so I ask questions all day, every day, and there's someone there on my team who answers. So you're never alone. um, I'm sort of kind of like an introvert, so staying at home is no problem for me. During COVID, we enjoyed being at home. We didn't have to go anywhere. And I was in the school system at the time, and we had to teach from home. And so that was my first case of working remotely.
Mhm.
And I said to myself, I can do this. I can do this. You have to stay focused because even though you're working from home, you are working,
You're working.
so we have to have a HIPAA compliant office, which I do. It has to be locked door, which it is. And you know, before I know it, Dale, I log in. Next thing I know, 3 hours has gone by. I've done missed my morning break, and it's almost lunchtime. So I just add that break with lunch. So yeah, I work with a great team of nurses. Yeah, especially my manager. He makes it really, really, really cool to come to work. So.
All right, all right. That's cool because I asked you because as you say, many people don't realize just how much work you can do from home as a nurse.
Yeah,
And I
yeah.
when I say that, I don't even necessarily mean the public. I mean nurses. Many of us nurses don't realize just how much there is for us that we can do,
There's a
not
lot.
in institution.
Right, right. There's a lot out there. When I started doing my research, I found that out.
Yeah, absolutely. There's a lot out there. What would you did do a lot though, institution. You worked in home. Listen, I have to tell you, home health, more power to you. I will tell everybody, I lasted one day. I lasted
Mm,
one day in home health, and I was like, this is not for me.
yeah.
So more power to you.
Love home
Yeah.
health. Home health. I'm from a rural area, and a lot of the patients I saw knew my family. So that made it
Uh-huh.
easier. Now of course a lot of them I did not know, but this is a small area. And so that's what made it easy to do. But I couldn't see myself getting older and still going into people's homes. I feel like, there was something else. And so, yeah.
Yeah. Yeah. But having worked in, so you've worked as a nurse's aide, you've worked as an educator, you've worked
Mhm,
as a bedside nurse, you've worked in the critical care area, in home health and all of that.
mhm.
What would you like to see change?
Ah, well, that there's this saying out there that nurses eat their young. And I hope that is still not the culture because I've been out of that, the hospital setting for
Mhm,
a long time. I was on the not so good receiving end of a nurse
mhm,
who, I don't know if she was angry or not, and still to this day, I'm not quite sure why she acted like she did. As nurses, we are the most trusted profession for the last 21 years. And so not only do we need to be a beacon of light to the members or the patients, we need to be a beacon of light to one another and help uplift one another so that we can grow. It's a sisterhood. So, we shouldn't have all that drama, so to speak, amongst the
I know.
nurses. We were told when we were nursing students that, these older nurses, they think you're coming for their job. And that's the last thing I wanted was their job. I wanted to learn because I wanted my own little niche, so.
Mhm, mhm. Yeah, all of that. I'm not sure why that exists exactly. Especially because we're working in such a dynamic profession. Things are always changing.
Right,
Whether
right.
we like it or not, we just have to learn from one another. You just have to.
Yeah.
Otherwise, it's very hard to keep up.
Hmm.
Right?
Hmm.
In all that you have done, what would you say is your greatest achievement so far?
I have a lot of them,
Mm-hmm.
but being able to teach students to
Yeah.
become nurses. I get them at the nurse aid. Well, I got them. I no longer do that. I keep, but
Mm.
I was able to teach them to be great nurses because that's the stepping stone to be a great nurse. And to see them go to nursing school, graduate, and have their dreams come true, that's got to be the greatest achievement. I wanted, I wanted to, I wanted students to have the experience that I didn't have.
Okay.
Nursing school was great. It was hard, but as a new nurse and,
Mm.
being on the tail end of angry nurses and things like that, it didn't, it didn't happen that often, but, I just wanted to let them know what nursing was all about and how it can be. And, and to see them so excited, to go in that field, I think that was my greatest accomplishment, being able to teach them how to be great nurses.
Yeah, yeah. That right there is awesome because there's absolutely nothing like planting a seed and watching it grow.
Right,
Nothing
right.
quite like it. Yeah. So I get that. How do you think you see nursing within the next decade or so? What would you like
Um,
to see?
well, like I said, I haven't been in the hospital setting for years, but from everything that's in the news, everything that I'm following, everything that I'm hearing, just nurses are getting burnt out. And so something has got to change. And, and it's more so in the hospital setting, or the facilities,
Mhm.
that patient nurse ratio is just it's illness has changed. So I remember being a nurse and I did 3 to 11. I worked 3 to 11. I think I had 10 patients, 12 patients, or something like that. But things were different, a little different back then. Uh, now we have all these illnesses, with this advanced technology, is so it just has to start with the ratios. It has to start also with our nurses uplifting and mentoring new nurses. Um, so that mindset sort of kind of has to change there so that
Yeah.
we no longer eat our young,
Yeah, yeah. I when you said that, illness has changed, I get that. I absolutely get that. I'm not really so sure that illness has changed. It's just, or is it just that, you know, there was a time when people stayed in the hospital
Right.
longer. so that some of your patients were further along the road of recovery. So that
Mhm.
patients, if you had 5 patients then, you had a couple of acute and you had some close further along the way.
Right. Right.
We're sending people home earlier now. So that the 5 patients that you have is that you have 5 acute patients.
Yeah.
And so the numbers, I don't know if the numbers have changed for sure because we keep getting more and more, but at the same
Mhm.
time, I think that what we felt was that the increased acuity, the increased burden of the same
Yeah.
number of patients is what is overwhelming us.
Right. 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 Most definitely.
What would you say to someone who wants to be a nurse now, though? You're an educator. You have been.
Mm. I would say someone who wants to become a nurse. Okay, so you got to go into nursing for the right reason. Um, there's an art and science to nursing, and in nursing school, we teach you the science, but the art comes from within. It is the person that you are. So if you're someone who does not like people, does not like to get along with others, does not like to take orders, I guess I can say, then nursing is not the field for you. You have to be empathetic, you have to be compassionate. So go into nursing for the right reasons.
Yeah,
That would be my advice. It's
yeah,
not easy. It is not easy, and you're going to be dealing with people from different backgrounds, and you just have to um, be patient. You have to be empathetic. You have got to walk a mile in their shoes to understand where they're coming from. So
exactly, exactly, exactly. And the way healthcare and nursing is portrayed, let us say on TV, does not help. Uh, it's portrayed as well, nothing near the reality anyway. We speak about you mentioned burnout and stuff like that. And that I think is one of the reasons. I mean, lack of self-care, as we're using that
Mhm.
term a lot now, is probably one of the reasons that we have this burnout. Because I don't think that we are even programmed to take care of ourselves innately and by
Right.
education. But what does self-care mean to you?
That is something that I'm currently working on.
Hmm.
Because I haven't always taken care of myself, because as nurses we feel like we have to be everything to everybody, and we tend to put our wants, our needs on the back burner. I'm not a person who goes to a spa. I'm not anyone who goes on shopping sprees or get my nails done. Self-care to me is sitting right here with my fireplace going and a cup of coffee, and
Mhm.
I don't even need the TV on, just taking in the moment, quiet, peace. I have a group of childhood friends who we are still best of friends, and we don't speak to each other every day. We don't see each other every day. But when we do get together, it's a sisterhood, and we uplift and we support one another. That's what you need.
Yeah.
But I am still on my journey of self-care. As nurses, we are pretty bad. Um, just that peace and tranquility of just being home in your space. And that's why I love working from home, because I'm
Mhm.
home, I am in my
You're
space.
in your space. Mhm.
Yeah, but I am still working on my self-care, still working.
I get that. I get that. I think that many of us are. And that is the whole reason I ask it. I ask it of every single nurse I speak to, because I really think I know that I need to articulate it, and I need to articulate it more. Articulating it once is not working. I've got
Right.
to articulate it, and I've got to stop and think about it. I've got to implement it. And I know that many of us, as you say, are just putting ourselves way and way on the back burner. And I just want us to stop, but as we talk, just take a moment and just articulate what it means to you.
Yeah.
Because if we don't articulate what it means to us, we're not gonna do it.
Yeah.
We're not gonna pay attention at all.
Yeah. Yeah. We got to listen to our bodies too. And
Yeah.
you know nurses make the worst patients, actually. We teach our patients on a daily basis, but we need to practice what we preach. And so that's part of my self-care too. I'm trying to be better at that. So
Yeah. Yeah, that is true. That is absolutely true. I'm glad you brought that up because, as I think I've said before, is that we accept things for ourselves that we wouldn't accept for our patients.
Right, 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 right.
Right. And maybe that's one of the places we need to start. If I don't accept this for my patient, why am I accepting it for me?
Yep, yep.
Yeah.
We don't even realize it half the time. So
We don't. No, we don't. We just kind of like, put our nose to the grindstone and keep
that's
going.
it. Yeah.
And the one of the focuses, yes, you want to take care of your patients and all of that, but you want to be finished or as close to finished at the end of that 12 hours as you can,
Mhm.
because you know very well that that 12 hours can stretch into 14 or 15 or 16. So that
Yeah.
I won't
Yeah.
bother to.
Yeah.
Yeah, yeah, exactly. Before we go, Connie, is there any last words you'd like to leave us with?
Hmm. Any last words?
Hmm.
For the nurses who are
Yeah,
nurses,
sure.
we just need to take care of ourselves. If we don't take care of ourselves, how can we take care of our patients? How can we take care of our families? And so we need to start putting ourselves first.
Hmm.
Um, that self-care, like we just talked about, that is really needed, and there's this big thing on mental health as well. Um, as nurses, we should not settle. We should not, the things that we used to settle for, we should not settle. I'm going to this process. I'm going to this process. Ever since I've been working from home, I'm seeing things differently. And I'm starting to put myself first. I'm starting to put my mental health first. I'm starting to make better decisions about my career and my career goal. Because when I became a nurse, the options that we had was either a hospital, nursing home, or a doctor's office. There's just so much out there. And if you feel like there is something you want to do in nursing, I would say go for it. Go for it. Don't don't regret it.
Yeah.
Don't regret it. Just go for it. The worst, like if you want to apply for a new job, the worst they can say is no. You already have a job,
Yeah.
so just keep moving. Keep moving. The worst they can say is no. You just
Yeah.
keep pushing forward because that job that you're seeking, that job, there is no perfect job, but that job that you're seeking is out there somewhere.
It is. Exactly. It is
Yeah,
absolutely out there somewhere. And you can put your name on it.
yeah, most definitely, most definitely.
Yeah, you can put your name on. That is one of the most beautiful things about this whole profession. It is
Hmm.
so is forgiving the word? Maybe. It is
Hmm.
so forgiving. It
Yeah.
allows you so much space um
Yes.
to just dream big, to dream huge,
Yes.
to
Yeah.
go wild and just do what you want to. Uh, Connie, thank you so very, very much for this conversation. I truly enjoyed it.
Thank you so much, Dale. Thank you for inviting me, and it's been a pleasure.
It has been my pleasure also.